So you started the practice about 30 years ago, 35 plus years ago, and you have created what you say is a great team. Tell me about your practice, the philosophy, the approach.
Our philosophy is fun is contagious. And we try to have fun in the dental practice. I have great partner, great associates. We have theme days with the patients.
Really?
Yes, we do. We have a Hawaii luau once a year. We've had cowboy days. Anything we can do to engage the patient. It's not work. And to go and provide dentistry and enjoy what you're doing, that's really my passion. I've been doing it for over 30 years, and I like change. I love the technology and all the advancements. I'm constantly studying. I'm still working 5 days a week. I've had veneers placed. I've had the 6-month smiles done to experience it.
On your own teeth?
On my own teeth. It can make you look younger. I'm actually 93 with these veneers. You would never guess that. Just kidding. But it's a great profession. I decided to become a dentist probably about 2nd grade.
Really?
We had a substitute teacher, Mrs. Ray, and her husband was a dentist. And I liked the science and almost went into art, almost went into advertising. And I loved science, so it was such a great blend with dentistry. And Mrs. Ray went to my mother and said, I think we have a dentist here. And I found that out some years later. In high school, I started looking around. I was very close to going into art. And then when it came time to graduate and I started looking at the science, I picked dentistry.
What's your favorite part? Because you know, I interviewed your partner. He says that he feels like he's changing people's lives.
Transformation is great, but really, it's making people feel better. Whether it's taking away their pain, building their self-confidence, just enjoying a conversation with people sometimes. That really, it's just the basic bread and butter of dentistry. Toothaches. I enjoy being Sherlock Holmes and figuring out what the problem is, how can I help you. That's very enjoyable. And we're really lucky in dentistry to have that type of a job that what you do can really be meaningful in a person's life.
Do you feel you have a different kind of a practice? A lot of people come to my, I interview, our show airs all over the U.S. and all over Canada. And sometimes doctors will say, we have a different kind of a practice. But we talked on the phone, and you truly believe that you have a different kind of a practice.
It is different.
Elaborate on that.
Well, when you walked into our waiting room, you might see a stuffed dog sitting there beside a chair, and you may laugh at that, but you'd be amazed how many people sat in that chair and would pet the dog as they're waiting for the dental appointment. Very relaxing. We also had some soft sculpture, life-size dolls in the office. I could tell you funny stories about that. One time the alarm went off, the police came. I forgot that the dolls were there. A policeman walked around the corner and saw a figure standing there in the dark, pulled his weapon and said, "Freeze!" Of course, we started laughing. He didn't think it was very funny. Another time, one of our competitors' team members were walking by late at night, and we left the light on. It looked like we had a waiting room full of people all night long. So a sense of humor, I think, goes a long way with...
Because people don't like going to the dentist.
They don't like going to the dentist.
But they like going over there, you say.
We are everywhere. We do billboards. We participated in the Beach Boy local festival and concert. We had umbrellas that said Friendly Dental Care, and sitting in the sun, it was great. Just whatever we can do to make life a little easier for everybody. Look good, feel good. One of my other associates is a member of the Academy of Sleep Dentistry. He's doing the sleep apnea treatments now, so now we can say you can sleep good. Look good, feel good, sleep good.
All right.
That's a different idea for a dentist, but that's what kind of our goal is.